MAHA keeps telling America they're here to fight Big Pharma, fight corruption, and make people healthy again. But here's the question no one wants to ask. Why are some of the same wellness voices around this movement pushing unapproved peptide injections while also selling peptide products, peptide consults, or peptide-related services? Because when the person telling you need this miracle shot also has a website ready to sell it to you, that's not health freedom, that's a sales funnel. Now, before anyone twists this, I'm not saying every peptide is automatically bad forever. Peptides are a real area of medical research. Some approved peptide-based medications exist. But this is not what we're talking about here. We're talking about the wellness world pushing injectable compounds for anti-aging, fat loss, recovery, muscle growth, gut healing, inflammation, longevity, and all kinds of miracle-sounding benefits, often without strong human evidence, without FDA approval for those uses, and without long-term safety data. And according to the FDA, some of these compounded peptides raise serious concerns, including immune reactions, impurities, limited human safety data, and in some cases, not enough information to even know whether they could harm humans. So when MAHA influencers are pushing these things like they're health magic, we need to ask the basic question. Where's the evidence? And just as important, who profits? The entire MAHA brand is built around this idea that America is sick because the system is corrupt. Big Food is corrupt. Big Pharma is corrupt. Government agencies are corrupt. And honestly, there are real conversations to be had there. But here's where it gets wild. If you claim the problem is financial conflicts of interests, then you don't get to turn around and sell people unproven injections while presenting yourself as the authority. That's the contradiction. Because if a pharmaceutical company pushes a drug without enough long-term data, MAHA calls that corruption. But if a wellness influencer pushes a peptide injection without strong evidence, suddenly it's health freedom. No, that's not a principle, that's branding. The Associated Press reported that unapproved peptide injections are being promoted by wellness influencers and RFK Jr. allies, with claims around things like anti-aging, healing, recovery, and performance. The AP also reported that some clinics sell peptide consultations and vials with syringes. ProPublica reported that RFK Jr. may reverse restrictions on peptides that the FDA had previously flagged. And former FDA officials said their earlier decision was based on real documented safety concerns. ProPublica also noted that despite exploding demand, there has been little new science. That matters. Because if the science hasn't suddenly changed, but the political pressure has, then we have to ask whether this is about public health or opening the door for a profitable wellness industry. The FDA has listed multiple peptide substances where it says there may be risks like immunogenicity, peptide-related impurities, limited human safety data, and inadequate information to know whether harm could occur in humans. And this is not some tiny technical issue. When you inject something in your body, you are bypassing normal digestive defenses. You are not eating a bean. You are not eating kale. You are injecting a bioactive compound into your system and hoping the person selling it actually knows what it does long term. That is a very different level of risk. And for some of these peptides, the FDA's position is basically, we don't have enough human data. We don't fully know the safety profile. There may be impurity issues. There may be immune response issues. So again, why are people selling this like it's already proven? This is the classic wellness industry pattern. First, create distrust. Tell people the whole system is lying to them. Then offer a secret shortcut. Tell them this is what they don't want you to know. Then sell the product. And the more complicated the product sounds, the easier it is to make it feel scientific. Peptides, biohacking, cellular repair, longevity optimization, regenerative medicine. It sounds impressive. But sounding scientific is not the same thing as being proven. That's how snake oil works in the modern age. It doesn't come in a dusty bottle from the back of a wagon anymore. Now it comes with a podcast, a lab coat aesthetic, a discount code, and a checkout page. Here's where this gets even more frustrating. We actually do have strong evidence for lifestyle interventions that reduce disease risk. We have evidence that dietary patterns rich in whole plant foods, fiber, legumes, whole grains, fruits, and vegetables are linked with lower rates of major chronic diseases. We have doctors like Dean Ornish and Caldwell Esselstyn, who have published work showing intensive lifestyle programs and whole food plant-based nutrition can improve and even reverse certain disease markers, especially in the cardiovascular disease contexts. And yet somehow, instead of talking about proven lifestyle medications, people want to sell you injections. Why? Because you can't patent broccoli. You can't charge someone hundreds or thousands of dollars a month for lentils. And you can't build a miracle shot empire around oatmeal, beans, greens, berries, and exercise. That's the real problem. The boring stuff works, but the boring stuff doesn't make influencers rich. Now, MAHA will frame this as access. They'll say people deserve the freedom to choose. And sure, adults should have autonomy. But informed consent requires honest information. You cannot call it health freedom if people are being sold miracle claims without strong evidence. You cannot call it informed choice if the risks are downplayed. And you definitely cannot call it anti-corruption if the people promoting the solution are also financially positioned to profit from the solution. That is the exact conflict of interest they claim to oppose. So here's the takeaway. When someone tells you they're fighting Big Pharma, don't just listen to the slogan. Ask what they're selling. Ask whether the product is FDA approved for that use. Ask whether there are long-term human studies. Ask whether the person promoting it profits from it. Ask whether the claims are backed by actual clinical evidence, or whether it's just a wellness shortcut wrapped in patriotic marketing. Because health does not come from chasing every new injection trend. Health comes from building a foundation, whole plant foods, fiber, movement, sleep, stress reduction, a healthy weight, clean habits, and a lifestyle that actually addresses the root cause of disease. That's not as sexy as a miracle shot, but it's a lot harder to scam people with the truth. So before anyone injects the next trendy biohacking compound because some influencer said it's the future, follow the money. Check the evidence. And remember, every shortcut has a seller. And remember, folks, every bite is a decision. Choose wisely.